So I want to welcome people back to another Zoom conversation. And today our special guest is Enza Loera, who's coming to us from Pennsylvania. Good morning, Enza. How are you?
Good morning. I'm doing well. Very glad to be here with you.
And where in Pennsylvania are you coming to us from?
I am in the suburbs of Philadelphia.
Okay, very good. How are things down in the Philadelphia area this morning?
They're good. It's starting to feel like fall, so getting some crisp weather out here.
Do you get foliage down there?
We do. We get plenty of foliage.
Okay, very good. Well, it's getting around this part of Maine, it's getting past peak foliage, so I'm sure it's working its way towards you. So what I want to do is begin right off with your connection to the Margaret Chase Smith Library, which, as we were both discussing this morning, it's inconceivable to us that it's almost 25 years ago that connection first came about. It's through a program called National History Day, which we here at the library coordinate the program in Maine as part of the National History Day program. And in part, it's because of our experience of working with you and seeing that a young girl at the time, and you were from the Pittsburgh area?
Yep.
Yeah. In 1996, tell people who you chose as your National History Day project.
Yes, I chose Senator Smith, and specifically her Declaration of Conscience speech against McCarthyism and the witch hunting that was going on during the time.
Mm-hmm.
And as a 14-year-old girl that had I have lots of animals here. It's like 7 cats and 2 dogs here, so it might get a little noisy. And that had a really profound impact on me, studying Senator Smith and her bravery at the time to speak out against what was going on during the Red Scare. I also was able to conduct numerous interviews with people who I can't even believe talked to me, especially as such a young kid. And I was really able to dig into her life and to just the enormous courage that she had to speak truth to power at the time.
So you mentioned some of the amazing people that you interviewed, and one of the things that floored me, and I still keep this handy, is your they call it a process paper.
Yeah.
And your process paper, and this is just sort of like the background of what you're doing. This isn't even the project itself. Your project paper is like 30 pages long, and it's these lists of all the sources that you cited, including these amazing interviews that you did. Can you give people an idea of some of the people you were able to interview?
Sure. I was able to interview the last living member of the Hollywood 10. I was able to really have a great connection with 2 of the biggest victims of the Cold War era, Julius and Ethel Rosenberg. Her sons, Ethel Rosenberg's friend in jail, Miriam Moskowitz, the co-defendant in the trial. I really got a feel for what it meant to be targeted during the time. So I was able to understand really what it meant to be a part of that witch hunt. And so I was able to get that context. In addition, I was able to get to know people who knew Senator Smith. I got a letter from Senator Goldwater, people who knew Senator Smith, and sort of was able to understand how amazing she was as well.
So Senator Barry Goldwater, she would have served with him in the Senate, but then also in 1964, he was one of the primary Republican candidates that Margaret Chase Smith was running against for the presidential nomination. He's the one who actually got the Republican nomination that year. So they would have had very close contact over the years. Just popping up, that's interesting. And so this amazing process paper, this amazing work that you did, I mean, it just, again, is one of the reasons that we decided to get involved with the History Day program, is just to see the quality of work. This is as a middle school student that you were doing this. And just tell people who the Hollywood 10 are.
Yeah, so the Hollywood 10 were a group of people who unfortunately were blacklisted by Senator Joseph McCarthy for allegedly having ties to the Communist Party. And at that time, certainly that wasn't illegal. That's a part of our rights as Americans to have unpopular beliefs, as Senator Smith reminded us in her Declaration of Conscience speech. But to have any unpopular belief at that time really was something that would ruin your career, and you couldn't get a job. You couldn't get a job in Hollywood. And unfortunately, if you got that label, people would go as far as even committing suicide, because they just, once you got that label, that was the end, no matter what profession that you were in.
So there was quite a few people in Hollywood who got blacklisted, which was an economic consequence. They weren't able to get jobs. And one of the famous ones was Burgess Meredith, who later went on, once he got unblacklisted, went on to be the Penguin on Batman. Another famous one was a writer named Dalton Trumbo, got blacklisted. So some very prominent people. But then there was also a few of them who, because they refused to testify, actually got sent to jail.
Yeah.
All right, so that was some of your research that you did for History Day. Do you happen to remember what the theme was that year? Because History Day is always organized around a theme. Or another way to ask it is, why in the world was a young girl from Pittsburgh, Pennsylvania area, how'd you come to know about Margaret Chase Smith, and why'd you want to write about her? Research about
it. The theme was it was about standing up to, oh my goodness, I can't remember the exact theme. This was so long ago. I should have looked this up. It was about standing up in history.
Okay. Taking a stand in history.
Taking a stand in history, yeah.
What they do, what I've been told, is because it's for 6th through 12th graders, so that's like a 7-year cycle, but the themes cycle through like every 7 or 8 years.
Oh, do they?
So it was just a couple years ago they did Taking a Stand in History again. And whenever they do that, we always get lots of young people who are interested in doing a project about Margaret Chase Smith. It's such a great example of something.
Yeah, and yeah, she is such an amazing example of taking a stand in history.
Mm-hmm. So prior to that, I mean, had you known anything about Margaret Chase Smith? And one of the reasons for asking that is the year that you chose to do the project is interesting. It's 1996, and she had just died in 1995. So that meant, she would have been somewhat in the news in that year for having passed away. But no, you had.
No, and I so regret not being able to meet her, being able to interview her directly. And I loved being able to go to the library and sort of feel her spirit and get to know you guys who knew her. And it was just so palpable, the legacy that she left behind. But no, I mean, I guess when I started researching her, I was 13, and I wasn't really that in tune with, Senator Smith, unfortunately, at that time. But when I heard about the theme and I started digging in, and I was very much entrenched in that at that point into the Red Scare and McCarthyism and all that. When I heard about Senator Smith, I was just blown away by her courage and her record. But unfortunately, I hadn't heard about her,
Okay.
and I so regret not being able to have met her.
I recently saw something that you wrote, which was inviting people to read her speech, her very famous Declaration of Conscience speech. And I noticed that you self-referenced yourself as being a giant nerd.
It's true.
Well, this is what giant nerds do. They produce this amazing work. Very impressive work. So what I think I'm going to do now is I'm going to go to share screen, because we've talked a little bit about this program, but now I want to take people in the Wayback Machine back to 1996 and 1997 so they can see some pictures of younger Enza as she is portraying Margaret Chase Smith and as she's winning. What you did is you won the national contest for your category, which would have been junior individual performance, correct?
Right. Yes.
Yeah. And you worked your way up through the ranks, through the regionals in Pennsylvania and then the state in Pennsylvania, and then went on to win National History Day in that category. Mm-hmm. Oh, let's see some pictures here. And let's see if I can get them in order. So this is you. Are you seeing the photo?
I am. My mom still has that wig in her house, actually.
Okay. So this is you, I think, doing the presentation at the National History Day contest, which would have been at the University of Maryland in June of 1996.
Wow.
What do you remember about? Do you remember that?
I remember being so nervous.
Okay.
I was so nervous. Yes.
Yeah. And my recollection, do you remember how many other students would have been there doing presentations?
There were a lot. There were a lot. I don't remember.
Well,
Yeah.
well, I mean, I should know the answer to that because essentially, I mean, every state and territory is allowed to send someone.
Mhm.
So that could be as many as 56.
Yes.
Yeah, yeah. And so out of that, as many as 56, you were the national winner.
I think there were 2 from each state at that point. First and second.
That's right, yes, because the first and second are allowed to go, right? Yeah, so it's even more competition. Yeah. And so what stands out to you 25 years later? I mean, what do you carry away from having done this research and done this? Essentially, what you did is you talked about the speech that she made. It's not like you did the speech. You talked about the thought process that went into her giving this speech, the background, the context.
Yeah, I sort of became her and talked about exactly like what led me to. I think I pretended that I was answering a question from a reporter, and went into why I gave the speech. What stands out to me is just that National History Day, in my experience researching Senator Smith, just instilled in me such a love of research.
Okay.
Such a love of being able to get history from first person interviews. I mean, that was just such a gift to be able to talk to so many people who are now passed away, to get a sense of just what it was like then. And I have just never take that for granted that, you know, as a kid, I cold called people. I mean, this was back before the internet.
Yeah.
I would call the operator, you know, on my parents' rotary phone in the kitchen. And I would call the operator and ask for, you know, people's Tony Alger Hiss's son, you know, Tony Hiss, and be like, could I have this person's phone number? And I would get connected, and I would give this couple minute intro of who I was. And every time people would talk to me and they would give me a chance. And I'm just so grateful for that. And I would have this crazy cassette recorder hooked up to the phone that my dad helped me connect. And I would say, you know, do you mind if I record this phone conversation? And every time they would let me, which was also such a gift. But to be able to be given a chance, I so appreciate that. And I read so many books at the time, but like to be able to get that first person account and to really understand the fear that people had.
Yeah.
Also just that speaks to Senator Smith's courage too, because her career could have been over as well. And she didn't care. I mean, she spoke up for what was right, and she didn't care if that she put aside her fear. She put aside everything else to say, you know, this is more than politics. This is about standing up for what is right. This is about standing up for what, you know, America is. And really understanding that whole context was just incredible. And sort of that instilled in me just a love of social justice, and just that has carried, you know, my whole career. Like everything that I do, I can trace back to National History Day. I mean, everything that I've done since then, graduate school and law school and my career now, is like, has its roots for sure in National History Day.
Well, you definitely dated this moment in talking about rotary phones and cassette players.
This was totally before the internet. I would go to the library and the card catalog, and this would have been way probably easier had I done the research on the internet, but this was just like an investigation, you know, where I got everything through a lot of hard work, and it was very satisfying.
Well, and you've also highlighted another very important aspect of History Day is what they really want young people to do is to learn history through engaging with primary sources.
Absolutely.
You very much excelled at that, which is why you won in your division. So talk to people, because they're seeing this picture of your portrayal of Margaret Chase Smith. How did you go about that in terms of look and speech?
I That's actually a suit that my teacher, Mrs. DC, who you see in the middle photo, gave me.
Okay.
And I had just looked at so many photos of Senator Smith, and she had just a beautiful dignity and grace about her. Then I tried to study her like you would study a character, in addition to kind of all the research stuff. Because I was in the performance category, I tried to also study her like you would, almost like really trying to get into the performance. And so putting on the wig, trying to get an accent, trying to just really embody her. And I watched a lot of live interviews and tried to get her persona in addition to, the content of it. And I don't know how well I excelled at that. I mean, she just was such a woman of grace, but I tried. And I remember Lynette King gave me a pin that I was wearing in that picture. You can see, I'm so sorry, my dogs are so loud. And her rose pin. And when I put that on, I remember that feeling. I just felt so close to Senator Smith. And I loved being able to have that pin on with a rose when I was able to give the presentation at the various levels.
Why did you decide to do performance rather than one of the other categories like exhibit or paper?
I think that it almost had to be a performance because of what it was, of what the speech was, the impact that it had. A paper wouldn't convey what that declaration of conscience speech was, just reading about it. I think it almost had to be, a delivery. And part of me was probably a little ham at 14, and I I wanted to do it. But I think also just the actual declaration of conscience speech and the story surrounding it really was most appropriately captured as a performance, and not just as a paper or something.
Did you have any drama theatrical background?
No.
So you mentioned your teacher, and that's your teacher right there.
Yes.
And what role did she play in the project?
She was my social studies teacher, Mrs. DC, and actually her husband, Mr. DC, Bill DC. This is Judy and Bill DC. They were probably the most influential teachers I have ever had. And they both taught me, one, how to really read history, not just to accept what I was reading, but really how to have a critical eye. And at 14, how do you not just accept what you're reading and accept it as truth? And so Mr. DC especially taught me how to double check and not just accept that as fact. And so that's something that I've taken with me for years and years. And so he was somebody who loved reading and who loved really sort of looking at things like puzzles and just looking at history with this very critical lens. And so he was a real mentor for me. And we would spend a lot of time, practicing our speech or just talking about history, talking about things, talking about Senator Smith. And Mr. DC has since passed away, but he was just such an influential person in my life and really taught me to love digging in deep to this kind of stuff.
So he was a history teacher as well?
He was the history day. He was a history day coach.
Okay.
He had been very much immersed in the history day program for years and years, and he helped with the program.
So there you are with your medal as well.
That's a big medal.
Do you know where it is?
I do. It's in my special box.
Okay. Very good.
Yeah.
And there's one more photo that I have, which is we were so taken by what you had done that we had you come to the Margaret Chase Smith Library the following year in 1997, almost a year later, and give your presentation at one of our library meetings. And so here you are. What do you remember about that trip?
Oh, I love that trip. That was such a meaningful trip to me.
Well, what I should let people know is that you had done all your research about Margaret Chase Smith, but to that point, you had actually not been to Skowhegan, not been to the library, not seen her house. Is that correct?
That's correct.
Right. So this was your opportunity to actually finally to come to this place that you had and see the home of this person you had done so much research about.
Yes.
Yeah. Any other memories? Did you get to see any of Maine while you were here, or was it pretty much just a Skowhegan trip?
Well, I remember, my family came, my grandparents came, I think, and we all just had it was such a beautiful trip. I remember being in Lynette's house, and just like, it was just such a beautiful time. And, the nerves were a little less because it was a year later now, and the pressure was off, and I was just able to kind of enjoy feeling Senator Smith, being in that library and just kind of, feeling her presence and being around people who knew her was a beautiful experience for me. And I love being able to talk to people who knew her, and feeling her spirit was just wonderful.
Mm-hmm. So that brings us up to 1997 in your life. And then I noticed on your Facebook page, you describe yourself as mom, professor, and animal advocate.
Yeah.
So to cover the next 23 years of your life, which one of those do you want to cover first, mom, professor, or animal advocate?
Well, I have 3 little kids. I have a 6-year-old, a 4-year-old, and a 2-year-old, and they are for sure the best part of my life. We have, as you are hearing, we have 2 dogs. We have 7 cats. We got some more cats during the pandemic because we were doing some fostering while we were at home. So we got some more animals here. And I am a professor. I'm a professor in the Center for Urban Bioethics at Temple University here in Philadelphia.
Very good. You're a very busy, accomplished woman. So how is the schooling situation going on during a pandemic?
Well, my son is in virtual kindergarten, and that is very difficult. It's sort of the worst. And it's hard, I think, for everybody. Having virtual learning is really difficult. And yeah, I mean, it's hard for everybody. And I think it's especially hard for folks who, don't have access to the internet. It's hard in a variety of ways. But we're working through it. We're working through it.
Okay. And you have a whole slew of degrees. You very much learned research skills and a love of learning and inquiry from probably not just from your History Day work, but from all your schooling, and have got a lot of schooling under your belt. You have a master's in social work. You have a JD, you're a lawyer. And you also have a very interesting degree that I had never heard of before, master's in bioethics. Can you talk about that? How'd you wind up with 3 degrees?
Sure.
3 postgraduate degrees, because you also have your bachelor's degree.
Right. Yeah. So, well, I went for my social work degree after college. Well, my dad passed away my senior year of college, and he had a kind of long battle with cancer, and I wasn't sure what I wanted to do after college. I kind of was going to go either right to law school or right to get a PhD in political science, and I sort of took a pause. College was rough because of that, and I decided to work a few years at a nonprofit, which I did out this way, and then I learned about the social work MSW, and I was like, well, this is great. This is sort of exactly what, sort of speaks to me now and my social justice calling. And I went to Penn for my MSW, and I got randomly placed as doing geriatric social work at Jewish Family Services in Delaware. I loved it. I absolutely loved working with that population. And at the time, I was learning just about all kinds of things that were impacting the older adult population, from policy, just all kinds of things. And so I ended up picking up the bioethics degree at Penn too, because I wanted to delve more into the sort of legal and ethical issues that were inherent in end-of-life care. I also wanted to understand the policies too that were impacting the older adult population that I was working with.
Mm-hmm.
So I did, and I loved that, and I loved working at JFS. I ended up working there as a geriatric social worker for about 5 years. I ended up going to law school too, because I still wanted to learn more about health policy and all the things that were impacting the older adult population. And so I went to law school at night while I was working as a geriatric social worker during the day. And that worked for me. I was able to help start an age-in-place initiative that helped older adults stay in their homes for as long as possible. Because as we know, most people don't want to go to nursing homes. They want to stay in their homes. And so there was a really creative program sort of modeled after this village movement out of Beacon Hill, Boston, that helped people do that. And so that's what led me to law school, and sort of all connected. I entered academia. I didn't sort of realize that I was going to enter academia.
Yeah.
I'm at the Center for Urban Bioethics, which has a very much does a lot of boots on the ground work. And so it has like a social work feel to it, which is very satisfying. We train healthcare professionals, a lot of medical students, doctors, nurses, social workers, lawyers, therapists, PAs, dentists, really how to be more empathetic and more effective in urban settings.
Okay.
Especially urban settings where there's a lot of disparity. We're in Philadelphia where, we still see the effects of systemic racism, redlining. There's still, where we are in North Philadelphia compared to the Liberty Bell, which is only 4 miles away, there's a 20-year life expectancy difference.
Yeah.
So it's 4 miles away, but still people 4 miles away are living 20 years longer.
Yeah.
So really understanding how to be the most effective and and knowing that you can't just tell a patient with uncontrolled blood sugar, go eat healthier. We're in a food desert or a food swamp, and really trying to be creative about the programs that we have. For example, we have a program that allows physicians and PAs to write scripts for folks to get healthy fruits and vegetables. So just like you would pay a copay for a prescription, you can pay $5 and get a big basket of fruits and vegetables. So really thinking outside the box of how we can best support our community, but also really be careful and make sure that any initiative that we do is community driven and community led, so that it's always responding to the actual needs of the community.
We had a speaker several years ago, I think his name was James Barone, and he was highlighting these disparities that if you looked at inner city Washington, D.C. life expectancy, and then the life expectancy of the suburbs of Northern Virginia, there were these 20 to 30 year disparities within 10 or 20 miles. And you're seeing the same thing in the Philadelphia area.
Absolutely. And it's, made even worse by COVID.
So can you give us some feel for how COVID is playing out in these areas of Philadelphia and North Philadelphia? And I should say that from the standpoint that here in Maine, we've been very fortunate. We've had very few cases. We're a much more rural state. We're more spread out. We're not compacted. Really the only places where there have been serious outbreaks are the more urban areas like Portland and Lewiston. But what is it like in a big city?
Yeah, so COVID has made things like food insecurity a lot worse. So COVID didn't cause food insecurity, but it made food insecurity worse. It made things like social isolation also worse. So people who were already socially isolated made them even more socially isolated, made housing insecurity worse, job insecurity worse. And so we really saw that, especially in our zip code in North Philadelphia, but also outside of our zip code. And so we were in the height of COVID, March through August or so. We really saw the impact of that. And there were a lot of reasons that people couldn't get out and get food, for example. Folks who were new moms, folks who were immune compromised, folks who were differently abled, could not get out and get food, people who had just lost their jobs. And so there were a lot of reasons. And I started actually working more as a social worker and trying to help connect people with food. And so the food distribution sites were well-meaning, but were a little bit tone deaf in the sense that they were set up so that people would tend to congregate close together, sometimes without masks. A lot of times these food distribution sites would run out of food. And so I would have clients tell me they would stand in line for 2 hours and at the end they'd run out of food. Or they would come and within 15 minutes, especially if it was like fruits and vegetables, they'd be out of food. And so this is in this landscape of like not having food, but we have food, in the United States, but it's like this great disconnect between having food and actually getting it to the people who need it most.
Yeah.
And then also, here we are gassing and killing all these farm animals and factory animals, and yet all these people don't have access to like meat and who actually need it.
Right.
So it's a very weird time for food insecurity. And also, COVID is really disproportionately impacting Black and Brown communities, and that is a real problem, and we're seeing that in Philadelphia as well. So, COVID it's very serious, and it's especially impacting urban settings, places where people are living close together, and where folks, don't have access to the things that they need, like food.
Are things getting better? Are they getting worse? Or are they about the same right now?
I think things are getting better. Temple University Hospital is an amazing place. They did a lot, during the height of COVID. We have just a great hospital system. I'm a little worried about what's going to happen this winter for sure. Yeah. But we'll see. Hopefully people will continue social distancing.
I heard on the news last night that they're starting to get worried in New York that they might be starting to see the second wave in New York.
Yeah.
With fall and winter and colder weather coming and people getting driven back indoors. So that's another great benefit that we've had in Maine, that we have so much outdoor recreational activity that we can do, but as it gets colder, how much of that will be possible. So do you get it all? You have this legal background, you're in academia, you're training people right now, but you also have this social work element. You're actually working with people who need help. Do you ever get into the realm of public policy, which would have been a realm that Margaret Chase Smith would have been very interested
in? So I teach policy to social workers, actually,
okay.
And that's one of my greatest joys.
So,
I get involved in policy in the teaching sense.
Okay. But not in the political sense.
No, I'm thinking about it, but I haven't made that leap. Yeah.
What are you thinking about? At what level are you thinking about?
I don't know. It's
just thinking about it.
I'm thinking about it, because I think, that part of the thing that, I tell my social workers is that social workers should inform policy because they know what's going on in community.
Right.
And we'd be in a better place if more social workers ran for office, because we'd be making legislation that actually, attacks the problems that are really happening in communities, and we'd be, having community members help inform that policy instead of like throwing hypothetical solutions at hypothetical problems.
Yeah.
And so I'm teaching that all the time, and I think maybe it's time that I also kind of throw my hat in that game as well. So it's on my radar.
Do you feel, well, you have a lot on your plate, so I understand that you may need to wait to act on that feeling. But do you feel like you have some public policy solutions?
I think, my go-to is always to make sure that we're involving the community in any solutions.
Yep.
And so that's always first and foremost, no matter what the problem is to make sure that we are asking the community what they actually think they need.
Okay.
So whatever the problem is, making sure that the community is actually consulted.
So it's not just top down.
Yeah, it's really, really important that we involve community members, whether that problem is homelessness or substance use disorder or education, no matter what it is, really making sure that we ask the community what they want and what they need.
And do you have a feeling that the community has some remedies in mind?
Yeah, no better expert, the
Mhm.
As I tell my medical students, the patient's the expert of her own story, and for legislation, I think the community, of course, they're the ones living it every day.
Mhm. Because you talked about these disconnects, and I sort of get some glimpse of it. That one of my other jobs is I teach in a jail, and you see lots of disconnects there. I mean, you see how um, people get into these situations, and the impacts that it has on the community, and um, how policy doesn't work. And even well-intended policy oftentimes doesn't work very well. The hell of good intentions.
Right.
So, what sort of things do you teach? You have different courses that you teach?
I do.
Yeah.
I teach on end-of-life issues,
Okay.
which I really enjoy teaching at the Center for Urban Bioethics.
Mm-hmm.
I teach a course on dying. I think that, we often don't discuss end-of-life stuff until it's too late. And so one of my missions is to really try to break down that stigma, both for healthcare practitioners, but also just for everybody like you and me, in our own families, we see that too. And so a lot of times people end up not having the death that they would want. They have a bad death. And I think it's possible to have a good death,
Mm-hmm.
meaning a death that you want to have, things you want as good as it can go,
Mm-hmm.
but we have to be able to talk about it. And so unfortunately, at Temple, we have a very low percentage of people who actually have advanced directives. And that's consistent with national trends. Most people don't have advanced directives, and there's a lot of reasons for that: religious reasons, cultural reasons, people just not knowing about them, not wanting to talk about it.
Mm-hmm.
And so I feel very committed to just wanting to be able to talk about it. And so I teach this course that trains nurses and doctors and residents and medical students on just how to have those tough conversations.
Mm-hmm.
I've seen it play out in my own family where nobody wants to talk about it.
Yeah.
And so I really enjoy that class.
Mm-hmm.
I'm looking forward to teaching in the spring or summer a class on dying and pop culture.
Oh,
So
interesting.
I know I'm very into topics related to end of life care.
Yeah.
And I teach the dental students at Temple. I teach the physician assistants. Any courses related to bioethics are always, I always enjoy them very much. And then, like I said, I teach policy to social workers as well.
Yeah.
I teach CEUs to social workers. So sort of any stuff related to that. It's always.
So in a typical semester, how many students are you interacting with?
Hundreds, because our center also does sort of the general ethics trainings for all of the medical students too.
Okay.
Which is great. And that's sort of, we're able to kind of, in a macro way, train the future physicians to how to best get out there and work with their patient population.
So is this element of bioethics something that's required of all Temple medical students?
Mm-hmm.
Okay.
Yeah, we have a master's program in urban bioethics. We're the only urban bioethics program in the country.
Mm-hmm.
And urban bioethics is like bioethics, but bioethics can sometimes be highly philosophical.
Mm-hmm.
And so, in times of pandemic, it's like you really can't be thinking about, what is autonomy in this sort of removed way. It's like, what are we doing right now for our communities? How are we dealing with food insecurity? How are we dealing with substance use disorder? So urban bioethics is combining both the theoretical principles that undergird bioethics, but is also very boots on the ground.
Okay.
So we have this master's program, but we also do, a lot of the general curriculum for the medical students and the PAs and the dentists and all of that.
Very good. So I have two final questions because we're getting close to the amount of time that I like to have on these interviews. And one is, this is a question that I was asked when I was interviewing for my job here at the Margaret Chase Smith Library. Do you have a sense of your career trajectory? Can you look ahead and see where you think you'll be in 10, 15, 20, 25 years? Or is it more day to day? It's getting day to day at this point.
Right now, it's a little bit day to day.
Okay. But you did talk about that you do have this idea about maybe getting more involved in public policy.
Yeah, no, I mean, all jokes aside, 2020 is a little bit day to day, I think, as we're all feeling right now. It's, just sort of making it day to day. But yeah, I think that my calling in general is working at chipping away at both, sort of micro and macro goals, meaning micro, working to better the community that I'm in. But also realizing that to see the changes that I want to see means that I have to get involved in a bigger policy way.
Yeah.
And so we can do good all the time, and we can impact patients or clients in ways that are really, really meaningful. And that is so, so important, I think. But to uplift the neighborhoods and uplift the communities in the way that I think we need to see happen has to happen on a policy level. And I think that I realize that, and I do want to be a part of that. And so in 10 or 15 years, I want to be a part of that dialogue. And I love being in academia. I love our students. I think that is exactly where I'm supposed to be right now. But I think in general, I am realizing that the macro level changes are very important.
All right. Well, I'll be looking for your name in the future in the public policy realm
And of
for
course,
some very important issues that need to be addressed.
always guided by Senator Smith and her courage.
And so the last one is, you mentioned this a couple of times. You talked about having a strong sense of social justice. Where did that come from?
I think part of it came from my work in National History Day.
Okay.
The year prior, I researched Ethel and Julius Rosenberg, and that research carried into the work that I did, with Senator Smith and how I came to know about Senator Smith. But understanding what happens when othering occurs and when injustice happens, occurred really when I was really young. And so hearing the stories, like I said, of, Ethel Rosenberg's best friend in jail, Miriam Moskowitz, who had a really profound impact on me, and who through my adult life, I maintained very close contact with. I think that was very important. But also just, I don't know, in the work that I've done as a social worker, seeing the disparity that we have firsthand in the clients that I've worked with. I don't know, I think we all have a commitment to our communities and helping to work to make things better.
Well, you remind me of one of the plaques I always highlight when school groups come through, because one of the things that Margaret Chase Smith is very committed to is the ideal of service, which is more than just military service or public service. It's community service as well. It's a plaque she received from the Salvation Army with just one word on it: others.
Yes.
That's
I
what
love that.
That's to Margaret Chase Smith. It was as simple as that service is about helping other people.
I love that.
Yeah. And you're very much out there helping other people in many ways. So thank you for sharing with us your experiences with the National History Day program and your work as a mother, a professor, and an animal advocate. And I wish you continued success, and hopefully it won't be another 23 years before we have contact once again. So
I sure hope not. It was
good luck
so
to you.
nice to see you today.
Keep up the great work you're doing.
Thank you.
And this is goodbye for another one of our Zoom conversations.